Hello, dear friends, I'm here with you. Sofya Dorinskaya, President of the International Bureau for Human Rights in Mental Health and head of the Sofya Dorinskaya Center for Medical Information. Some time ago, we had a live broadcast with Alexander Danilin, where the two of us, as psychiatrists, reminisced about the Soviet classification of mental disorders, mental illnesses, and the old, very old, pre-Ernier-Leptikov classifications. Psychiatry textbooks, which serve as the foundation for clinical work and the search for the causes of mental disorders, have long described psychotic manifestations and psychoses in various somatic diseases. These essential texts provide the framework for understanding complex conditions. Today, I would like to provide you with a helpful and relatively brief overview of a standard psychiatry textbook to explore these concepts further. This specific volume was originally published back in 1960, having been co-authored by the esteemed researchers Portnoy and Fedotov and released through the Medgiz Publishing House in 1960. With this significant historical reference in hand, I want to take a moment to respond directly to those colleagues of mine today who have been questioning these established methods. When I state that vitamin deficiencies can cause severe neurotic and severe psychotic disorders, this scientific proposition is frequently and summarily dismissed as if it were pulled out of thin air, categorized as nothing more than mere pseudoscientific speculation. And this viewpoint is subjected to intense ridicule and mockery from various skeptical perspectives. However, clinical practice consistently shows that the meticulous process of identifying underlying physical illnesses in people with mental disorders, conducting incredibly thorough research into their daily diets, developing comprehensive meal plans, and systematically addressing specific nutrient deficiencies. In almost all cases, except for those instances when the brain tissue is already, so to speak, in a ruined state or has been so for a very long time. For example, if a person was already intellectually disabled at birth and now at the age of 30, people come to help, well, to put it bluntly, you can't regrow a severed leg. Or if a person has been taking neuroleptics for decades. In other words, some already quite serious situations. And even in these cases, we still achieve relief from psychotic symptoms, calming of the person, and so on. So a comprehensive and detailed review of a 1960 textbook, I think, will effectively address and clarify many of my colleagues' persistent confusion about exactly where all these professional assertions and clinical observations, both mine and those of other psychiatrists, regarding the vital need to look for physical pathology actually come from. So, in the introduction we read about Soviet psychiatry, that a thorough study of exogenous factors in the origin of diseases allowed Soviet psychiatrists to properly assess the role of hereditary and constitutional factors. Let me put that in simpler terms. A thorough study of exogenous factors, those very real existing physical illnesses or toxic effects on the body. It was precisely this thorough research that allowed Soviet psychiatrists to properly assess the role of hereditary and constitutional factors. The study of exogenous psychoses was developed with particular care. Not about endogenous ones, roughly speaking, those that just happen for unclear reasons, but about exogenous ones, when the cause of the psychotic state is precisely identified and can be brought under control. So the study of exogenous psychoses, infectious, toxic, and traumatic, was developed with particular care. This not only helped to understand the clinical presentation and pathogenesis of these psychoses, but also deepened scientific knowledge regarding those neuropsychiatric disorders in which the so-called endogenous factor was considered to play a leading role in their origin. That is, when Soviet psychiatrists looked at so-called endogenous diseases like schizophrenia, endogenous meaning it came from nowhere for some internal reasons that no one knows about. So, careful study of exogenous factors, these are infections, intoxications, and injuries, help to understand the clinical presentation and pathogenesis in these very exogenous psychoses whose origins are unclear. This is, in fact, an enormous scientific effort, a huge amount of observation, research, and monitoring of patients. After all, medicine is actually established on millions of human lives, on millions of lives. And next I will show you the classification of Soviet psychiatry from 1960, the classification of mental illnesses. And let's quickly go through them. So, infectious psychoses. Psychoses associated with acute infections, infectious delirium, infectious hallucinosis, amentia, post-infectious amnestic symptom complex, and so on, infectious encephalitis and meningitis with an acute course, purulent and serous meningitis, brain abscess, rabies, infectious encephalitis with a protracted course, mental disorders in infections with a prolonged course, brucellosis, tularemia, neurosyphilis. Very interesting. In this day and age, it almost feels as if people have completely forgotten the fact that neurosyphilis still exists. But you know, maybe I'll take the liberty to say this. Maybe my videos have actually played a significant role in that. Maybe overall, after all is said and done, the refusal of real doctors to just bombard people with neuroleptics, labeling them as insane, still makes doctors look for the root cause of psychosis. And just last week I read on the Doctor at Work website a report by a dermatologist-venereologist who identified a case of neurosyphilitic psychosis, made an accurate diagnosis, prescribed the correct therapy, and within the expected time frame achieved the involution of the psychosis, its disappearance, the person regained their senses, and so on. And then what do we see next? This specifically concerns syphilis. Further in the discussion, I see that dermatovenereologists are saying that the widespread use of antibiotics by the population is masking the clinical picture of syphilis. Those very vivid manifestations of primary syphilis are no longer present. There are even described cases where they are completely absent. Those striking symptoms, like the hard chancre and so on, are just not there anymore. And everything then manifests as psychosis, meaning the pale treponema crosses the blood-brain barrier, even though in general everything seems calm, or people self-prescribe antibiotics and quickly take them. These symptoms get masked and the treponema settles in the brain tissue, and after some time it begins to cause symptoms of neurosyphilis. This hasn't gone anywhere. It's just that as life changes, medications, even antibiotics, are becoming very accessible. No matter what is done now, antibiotics are already available. And they will always be available to people from now on. Naturally, the clinical picture is changing, but psychosis in neurosyphilis remains just as it was before. And the fact that this teaching hasn't been discarded, so to speak, is what we see here. A break in the symptomatology. Well, okay, what are we reading here? I don't know. Just a second. So, this is a practical guide, that very ICD, right? So what kind of classification is this? Bipolar affective disorder. What is this supposed to mean? Does it say here what the cause is? Panic disorder, and so? Now here I understand is a classification of infectious encephalitis with a prolonged course. Here you go, infectious psychoses. I understand, and further on as well. Here the signs of psychosis are described which indicate an infectious origin. And what is this? Well, I don't know. Take any one you like. Absence or loss of sexual desire. And so, this can happen with asthenia, it can happen with a brain tumor. What kind of diagnosis is this? And this isn't medicine? They've torn a person apart, separated their mental sphere from their physical sphere, and call it medicine. Psychiatry has stopped being medicine. It's just an excuse to prescribe someone neuroleptics or antidepressants. So, moving on, let's take a look. This is the classification from a 1960 textbook. Poisoning by alkaloids, that's clear. Poisoning by toxins ingested with food. occupational poisonings, mercury, lead, carbon monoxide, carbon disulfide, and so on, gasoline. Drug addiction, that's clear, and then comes the following. Psychoses resulting from traumatic brain injuries. And then here are the clinical signs of these psychoses, yes, descriptions of these psychoses, mental changes in brain tumors. So for example, psychosis in traumatic brain injuries, traumatic dementia, traumatic epilepsy, traumatic cerebrasthenia. And then it continues, mental disorders and somatic diseases. It feels like psychiatrists and today's clinical psychologists have never even heard that peptic ulcer disease can cause mental disorders. Liver diseases, kidney diseases, metabolic disorders, malignant tumors, psychoses in renal failure, alimentary dystrophy. My warmest regards to vegans and to all kinds of dieters, those who fast and so on. Here are your mental disorders caused by alimentary dystrophy. You ask me, why am I so... Sometimes I can't get up, sometimes I have hallucinations, sometimes I have panic attacks. There you go, alimentary dystrophy. This is exhaustion due to lack of food. And what about vitamin deficiencies, my dear colleagues? What about vitamin deficiencies? Page 72. Heart disease, diseases of the endocrine glands. Mental changes in vascular diseases of the brain. Mental changes in presenile and senile age. Well, next here comes schizophrenia, epilepsy. And then let's quickly run through the rest. Today, my goal is simply to quickly go over everything. And of course, I want to, later, as time allows, I hope to post articles, even full chapters from this textbook, on the website or in our live journal. In general, I'll see what works best for me. Subscribe to our evidence-based medicine groups on all social networks, Facebook, vKontakte, and Odnoklasniki. And there, whenever I post something on live journal, I simultaneously share it in all these groups. So, neurosyphilis with epileptiform seizures, syphilitic hallucinosis, and paranoia. Please, here is the differential diagnosis. Next, well, alcoholic hallucinosis is clear enough. Mental disorders due to brain injuries. There is a separate topic here. Delayed mental disorders after brain injury. That's right, yes, that's the way we're going. Mental disorders associated with metabolic disturbances, exhaustion, and vitamin deficiencies. And what do we read here? Mental disorders related to vitamin deficiency have been especially well studied in pellagra. I can tell you that according to our statistics among children with intellectual disabilities and autism, pellagra ranks first. This is a severe deficiency of vitamin B3. And when these truly unfortunate autistic children suffer from celiac disease, which is essentially a severe inability to properly absorb gluten from various grains. Guys, I would like you to please take a very close look at the visible symptoms of pellagra in these poor children right now. After all, pellagra is a severe deficiency of vitamin B3, the 3 Ds, diarrhea, dermatitis, and dementia. In English, there's a 4th D, death. But I can tell you that the clinical picture of deficiencies, since avitaminoses, they don't have a causative agent like, for example, bubonic plague does. Even if it was present in the 15th century with those symptoms, it will still present with the same symptoms today. Essentially, nothing has changed. But when we talk about avitaminosis, about the manifestations of vitamin deficiencies, now what I see, based on the data we receive regarding the signs of nutrient deficiencies, things have actually changed somewhat. People eat different food now. There are a lot of preservatives, a lot of colorants. People take a lot of medications. Children are also affected by the medications their mothers take during pregnancy, and even when the mother is growing up as a girl, because all of this is stored in fat tissue, one way or another. And I won't hesitate to say that, in principle, in a certain sense, the composition of the body, perhaps some biochemical processes, are still a bit different in people now than they were 100 years ago. People have even become taller. After all, this comes from somewhere, right? And what do we see? Those same dermatitis cases, now they present in a more blurred way. So the child has dermatitis. Buy an ointment with zinc. You bought an ointment with zinc, everything went away, but after some time it appeared again. Why? Because a vitamin B3 deficiency is closely linked to a zinc deficiency. They accompany each other. And so you get these fluctuating symptoms. Diarrhea. Now it can change from constipation to diarrhea. It may simply manifest itself as a rumbling in the stomach or some mild intestinal disorders, because now there are a lot of means. If you want to be smart, be dumber. If you want there, don't drink Ren. That's what you want, Spomisan, drink it there. I don't know. And here is the mass of everything. But what never goes away with pellagra is dementia. This is dementia. And so this child sits there, practically insane, who doesn't make eye contact, who doesn't understand what's being said to him, who screams in the corner just like a little wild animal. He's an autistic child with pellagra. Check the person. Just give the person vitamin B3. Our protocol is actually a bit more advanced, I can say. And we have a lot in there. It's not just vitamin B3. There are many, many components, and they are all very carefully selected and so on. But why did you just throw out pellagra? What are we giving these children? Neuroleptics. What are psychiatrists and neurologists saying now? Neuroleptics treat the brain. I've said this before and I'll always say it. Treat your own brain with neuroleptics first. We'll see how that goes for you. So, mental disorders related to vitamin deficiency have been especially well studied in pellagra. Pellagra arises as a result of poor nutrition and a lack of B vitamins. These disorders are typically characterized by the presence of diarrhea, dermatitis, and dementia. While the first two symptoms are found in pellagra with considerable consistency, dementia is a relatively rare symptom. Since doctors today are unaware, they can't catch pellagra at its earliest stage. When diarrhea and dermatitis are present, nowadays it tends to manifest as dementia, much more frequently. At the onset of this vitamin deficiency, irritability, depression, lethargy, apathy, headaches, and insomnia develop. Later on, impaired consciousness may be observed in the form of delirious episodes accompanied by anxiety as well as visual and auditory hallucinations. Now imagine a child like this coming to see a psychiatrist with a delirious episode, anxiety, and visual and auditory hallucinations. Honestly, I can bet that they would diagnose him with early childhood schizophrenia and start treating him with the full range of antipsychotics. In cases of dementia, severe memory disorders are found, similar to Korsakoff's syndrome. With a deficiency of vitamin B6 in the body, especially in infants, the following may occur: epileptiform conditions such as major and minor convulsive seizures. Ladies and gentlemen, neurologists, when you see these unfortunate infants, who also come to us, though we don't usually take on very young infants, but parents still reach out to us. Here you go, parents of infants who are now taking valproic acid, which destroys the liver. And in general, it's unclear how this whole situation will end. So, with a deficiency of vitamin B6 in the body, in children, especially in infants, epileptiform conditions such as major and minor convulsive seizures may occur. And now, well, then comes Basedow's disease, and it goes on from there. Addison's disease, mental disorders in diseases of the pituitary gland, brain tumors, and so on. Now compare this. This is the Soviet classification. If I haven't taken it out, here it is, here it is. This is the Soviet classification of mental disorders, and as you can see, it fits on about 3 pages. And all this abundance of nonsense, everything it does, it tells you how crazy you are, how crazy your children are. Abnormal behavioral disorder is considered a psychiatric diagnosis, and the only solution is to prescribe a psychoactive substance. That's the whole solution. All these treasures, treasures of wisdom, treasures of observation, truly things that helped people, allowed them to be cured, to be rehabilitated, have been thrown away like garbage. And now psychiatry has really turned into something else, into some kind of insane monster, a drug dealer who just sits there and, like a monkey, prescribes these neuroleptics. So, I want to be very clear that I haven't made any of this up at all. The truth is that there are simply many dedicated people out there who steadfastly refuse to believe in this absolute nonsense, and who are able to meticulously search for and find original old data, to find old data and evidence from the past, and apply common sense in psychiatry with the desire to help their patients. This was Sofya Dorinskaya with you. All the best. Goodbye.